Border controls tightened. Visitors with recent travel history to most South Asian countries will be blocked from entering the country over COVID-19 concerns. And for more analysis, we're joined by infectious diseases specialist, Dr. Leong Hoe Nam. Dr. Leong, thanks for joining us this evening. Firstly, how effective will the new measures be in stemming further infections? We're talking about curbs like closing public places and limiting social interactions in the next few days.
I think the curbs are necessary. However, I do have my doubts as to how well they work. Number one, at the end of the day, it's about compliance. And honestly, Singaporeans are really very tired of face masks and social distancing and doing a safe entry. And if you really look at the situation, you see many times where there's actually no safe distancing. And number two, some of the measures that are already put in, well, the measures are already there. And if you actually tighten a little bit more, you're going to just tighten the screw bolts a little bit more, but I don't think it's going to make a lot of difference. However, I do see a need for it because you are going to send a strong message out, especially to the malls that are packed with people. We just have to cut the numbers down. We are at risk, and the reminder is this. We have no idea where the source came from. The source is out in the community. We can't find it. We're going to be in trouble.
And Dr. Leong, with that in mind, given the latest spike that we're seeing in COVID-19 clusters, how concerned are you that we might see a new wave of infections, just like what some other countries have experienced?
Let's look at it. We are not immune to it. And over the last 6 to 9 months, I've been predicting we're going to get a big one, and big one. And surprisingly, Singapore, you've done very, very well. And we managed to hold it all the way to now. And now we have it big, and then it really hits us in our guts when it's in our hospital, our Center of Excellence for National Center of Infectious Diseases. Now, I am not surprised, and I think it's going to be the way forward because we're dealing with a mutant. I think it would be the mutant from India. We have a mutant which actually is highly transmissible and is overcoming many of the resistance, including the vaccine's resistance. So with all these, we are in the right setting, we are in the right frame of mind for the virus to actually cause more infections. So I am very worried that this will be the beginning of a few more. But I want to stress to the public again that if we've done it in the past before, we can do it again. And now we actually have the vaccines to help us. We can get it done.
Yeah, complacency, something certainly to guard against. We've seen quite a number, though, of vaccinated people getting infected again in Singapore. Are our numbers within global limits? How concerned should we be?
I think we are within global limits. We have to remember a few things. There's a 95% efficacy. So if there are about 100 people that are exposed, 95 of them will be disease-free and one of them will be infected. If you look at these numbers, then we have about 5 healthcare workers. You can imagine that another 95 healthcare workers were supposedly exposed, and in turn, they would actually have been sick. Think about it. If these people didn't get vaccinated, they're going to be in trouble. The second thing we must remember is we're not dealing with the first variant, the first generation of virus, which came in January 2020. We're talking about a new variant, a virus that's adapted to those people that have been infected, a virus that's adapted to infectivity. And of course, it's going to be harder to control it with the existing vaccines. And with this, we expect vaccines failure rates to be higher. Indeed, Pfizer and Moderna, the CEOs have predicted it, but the vaccine is still effective. Hence, I would see a bigger numbers, but I'm not worried because at the end of the day, number one, it is still vaccines that will help us tremendously. Not the only way, but it is a crucial way. And number two, the next thing is the amount of antibodies, the immunity which you have. And the CEOs of the pharma companies have talked about third dosing. And indeed, Dr. Kenneth Mark himself have talked about having a third dose and looking at the antibodies. And we may require a blood test to do later. Watch this space. We're going to get guidance on that from the Ministry of Health.
And for those infected cases that we've seen at Tan Tock Seng Hospital, Dr. Leong, how much more serious could have the consequences been if those individuals hadn't been vaccinated?
Dreadful, really dreadful. Look at India, we could easily be half or 3/4 of where it did. Number one, the healthcare workers, they will be decimated because a lot would actually have fallen sick instead. And these are healthcare workers who have used to be wearing masks day in, day out for the last 18 months, and yet they still fell sick. So it tells you the transmissible virus is really different. So without vaccination, I would have expected at least another 80 to 90 healthcare workers who are sick. Take 80 to 90 staff from an overworked Tan Tock Seng. You have the recipe for the entire collapse of the system of Tan Tock Seng Hospital. Take out Tan Tock Seng Hospital, the entire healthcare system in Singapore would literally collapse. So if anything, the vaccines actually have sustained the healthcare institutions and sustaining the healthcare workers. And I can't not say again and again how important vaccinations is. And I would urge everyone out there, if you have not been vaccinated, get yourself vaccinated. Because this virus is like a tiger that's going to prowl around all of us and find a weak link. That weak link would be the individual that's not been vaccinated. It will infect you and in turn infect the rest of the family. Don't score your own goal. Get vaccinated and protect yourself.
All right, thanks as always for your time this evening. We've been speaking with infectious diseases specialist Dr. Leong Hoe Nam.